Welcome, everyone. Welcome to the December 2025 edition of Aging Matters. I'm Jessia Jones. I am the director for the Berks County Area Agency on Aging. And today I have with me a special guest to do some education for us about pharmaceuticals, medication safety, and actually vaccinations. We're going to talk about a little bit because that is this time of year. So I'd like to welcome Dr. Patel. He is the president, owner of the Medicine Shoppe in Shillington. Welcome, Dr. Patel.
Thank you.
Thanks for your time today. I feel like we have some really important information that we can share with the viewers. I really want to kind of just start out with you to tell me a little bit about the role of the pharmacist and the services that they can help us with when we're choosing a pharmacy or, dealing with medications. If you could just give our viewers a little information.
So typically back in the days, the role of the pharmacy was to dispense medications. And, normally we just view pharmacists as a product-based professional, but it's not. We do a lot more than just dispensing medications. Yet, yes, the dispensing part is the main role. But one of the things that we do is make sure you understand the medication, counseling, the access to the pharmacy. So you could walk up to a pharmacist anytime and ask them questions. So we know everything about the disease and the medication that this is being used. We also make sure that there's no interaction, especially if you see multiple doctors. The pharmacists make sure that all the drugs are safe to take with each other. The other services that we offer as a pharmacist is MedRecon, where we look at all your medication, compare the medication with the medical conditions that you have, make sure your allergy is updated. There are also programs that it's called medication management therapy, where we go through detail with all your medications, including any concerns you have. The other one, financially speaking, we also give an alternative to some of the expensive medications. So, and then you have the free delivery services or paid delivery services that you get. If you can't get to the pharmacy, we'll drop off the medications to you. You mentioned the word choosing the pharmacy. I think that one of the big thing that as a patient I would consider is the access. Can I get someone on the phone right away? Especially if you end up in emergency room and you need to know your medication list, can you get the list right away? Mail orders, pharmacy, are very popular and they're convenient, but can you get someone on the phone within 5 seconds? That's one thing I would look at. The pickup time, for most part, the copay is determined by your insurance. So I would judge a pharmacy based on the service, because if the copay is going to be the same, if the price is going to be the same, why would you go with a subpar service?
Absolutely. So you touched on a bunch of different things. You talked a little bit. So as far as cost barriers, you're saying then that if you talk to your local pharmacist and you're saying this particular medication is very expensive for me, then you mean like the pharmacist will basically go look at other options and then reach out to the physician and have conversation. Is that typically how that works for the customers?
So if a brand name has a generic, by law we have to dispense you the generic. Unless stated by you or the provider.
Oh, interesting to know.
There are different classes of medication. So, for example, if you have if your cholesterol is high and you need to be on cholesterol medications, there might be a particular brand name medication that might be really expensive, but there's an alternative. So it would those different kinds of medication would be the same purpose, just cheaper cost. If the cost is the barrier.
Okay, that's interesting to know. That's good to know for our viewers, because I know a lot of individuals, especially the older adults, where they're have a limited income. So really always kind of keeping that cost barrier in mind is important. Kind of a simple question. I think I know this answer, but just for our viewers too. Will the pharmacy sync up the medications so that kind of I can get, can you do your best to try to get all my meds? So let's say I take 4 or 5 medications. Can you try to work with me to sync that up so I get them all filled at the same time?
I think, you know, from the back counter, that is a must requirement for pharmacy nowadays to survive
Okay.
and to be able to provide a much better service. We could absolutely, not only we do at the Medicine Shoppe, we have 80% of our patients saying, 80% of the prescription that gets out is saying. That what does synchronization means is, let's say if you want to pick up your medication every 30 days, 4 days before 6 days before your pickup date is set, we'll call you up and just make sure, hey, do you need all this medication? Are there any changes? Do you need any per diem or has needed medications, any over the counter? 4 days before if your pickup dates, we actually get all those medications ready, and then it's ready by the time you pick up, and the cycle keeps repeating. So we could do 30-day cycles, 90-day cycles, and for a packaging patient, we do 28-day cycles.
Okay.
And within that 6-day range, if you don't have a refill, we'll contact your doctor and get it ready. So by the time your pickup date is there, everything is ready. And you know, for whatever reason, if your doctor needs to see you, then we'll inform you that, hey, you know, hey Jessica, you'll have to call your doctor and make an appointment to get this refill. But it's not like a surprise at the counter where you walked in and you're like, hey, we don't have it.
I don't have it.
Yeah, and same thing with pharmacy, right? It helps us on our end also to make sure that all the medications that you needed were ordered. So if your sync date falls on Friday, we'll make sure it gets ordered on Monday. So everything will be ready on your pickup date.
Great. So one of the things that I wanted to talk about a little bit is you mentioned about kind of doing some counseling around medications. What about diabetic training and diabetic education? Does the pharmacy have any roles in some of that with some of the medications, and what would that be?
So, you know, typical pharmacy, we do counsel on medications. At the Medicine Shoppe, if you have a continuous glucose monitor or if they prescribe you blood glucose monitor.
Like the little machines.
The little machines, we make sure, first of all, it's easy for us to set it up than someone when you go home and set it up. So our policy is to make sure we set it up for you. And most pharmacies do this.
Okay.
You know, I'm just trying to distinguish Medicine Shoppe, but most pharmacies, they'll set it up for you and they'll also teach you how to do it. So
Okay.
the Dexcom, the Freestyle Libre, we'll make sure you understand how to put it on and everything, and then program it for you. Specifically diabetic educations, pharmacists are allowed to do it. In fact, Medicare acknowledges that, and we could bill it. We have not started that program, and there are pharmacists that do it though.
Okay. And that's interesting to know too, that it would be something billable under Medicare, under those services too.
Yep.
So great. So holidays are coming, families are visiting. I wanted to talk just a little bit about medication safety, safety around the home, and just get from you your perspective on ideas around securing medications in the home when you have family coming, young children, maybe even your daughter's bringing their dog or their cat. Any thoughts you have on medication safety overall and securing those?
So that's a great point, actually, because a lot of the time when you're by yourself, nobody's visiting you.
Right.
The medications are all over the place. Not all over the place, but it's secured in your
Sitting out
bathroom or kitchen, right? They're sitting out on the table. Because I have seen that when I go do vaccine at people's home, their bottles are just literally sitting on the kitchen counter. And most of them are non-safety, so kids are they'll be easily be able to open it up. So if you're expecting kids, one thing I would, you know, from the first thing would be to make sure the bottles are secure somewhere.
Right.
But you also want to make sure the lids are child-proof as well if you're
Okay.
expecting a kid. Just you know, it's common to drop a pill and not even know because it doesn't make a noise. I mean, you know, it's easy for me to say at pharmacy, hey, make sure you don't drop a pill.
Right.
But if that happens, just look around and make sure that there's no pill around, especially if you have a pet. Or kids, you know, they'll just think that it's a
So
candy.
like if you count what you have in your hand before you actually take it, if you're dumping it out of like a Medi planner or something, just some thoughts around that.
Yeah.
Okay. And then the other question I had for you, which is still related to medication safety, but sort of in a different way, is Is it important, in your opinion as a pharmacist, I mean, I know maybe this might be more of a physician, primary care physician question, but do you think there's importance in taking the medications as prescribed? And why? Like, what is it, you know, around why is that an important thing to consider?
So, number one, if your physician prescribed you medication, you are supposed to take them properly. There are some medications that are as needed, but if something is given to you, you know, I'll break it down to class, right? So if it's an antibiotic, you might feel better in 3 days, but the bacteria is still in your body, so you have to complete the course, 7 days, 10 days, 5 days, whatever your doctor prescribed. So that's important. When it comes to chronic medications, the doctor who is prescribing you is assuming that you're taking the medications every day.
Right.
Okay. If you don't take that every day and you go back to your doctor and you complain, guess what? He's going to add a new medication. I'll give you an example. Blood pressure medications. We had a patient that was on 3 different kind of medications. And I was on bench. You know, I was working as a pharmacist. I get another prescription. I knew this patient really well. So now she was already on 3. And one of them was a combo, so that he was on total 4 medications for blood pressure, and the 5th one comes in. So, you know, I was like, I called the doctor up, and I'm like, hey, doc, I see you send this medication, but I wanted to make you aware that this patient has not been picking up the medication.
Okay.
So what happened is, you know, we didn't end up dispensing the medication, but the patient is now worried. So she started taking all those 4 medications together. She ended up in ER because her blood pressure was low. So I think it's important to take your medications. I get it. In theory, it sounds great. But even if you are, I would say, 80% compliant, so like a lot of the agencies, including Medicare, considers 80% compliance rate as a good. So 80% is good. In my opinion, it should be close to 99%. 100% is not possible. And that's why we came up with the medication compliant packaging. What we notice is patients who are not on our compliance packaging, they're 80 to 90% compliance because we have sync program and everything. Patients who are on our compliance packaging, they're close to 97 to 98% compliance. You know, you'll still miss here and there, but that, you know, there's a significant difference in compliance.
So explain to me what you mean by compliance packaging.
So when I say compliance packaging, it's either pouch packaging that has your name, date, time. So it starts off with your name, then day, date, and then time. So if you're taking 3 times a day, you'll have 3 different pouches or a blister. Like, you know, they also come with a blister package. So that helps you make sure that you're taking your medications. And it also solves one of the problems that people don't normally think about it is, hypothetically, if you have a bottles and you took your medications and then you doubt yourself, did I take my medications or did I not take my medications? And I've seen patients end up in hospital because taking it twice.
Right. I fill a MediPlanner for myself once. I only take medicine once a day, but I have had that for myself. You know, and I don't fit even into an older adult category yet, but it still is one of those things that there have been days where I'm like, did I take that this morning? You know, so it does help to really kind of keep you on track.
It does,
so I understand what you mean.
Especially the date and the time, right? Then you could be sure. In fact, the new technology they're coming up with is the machine will track if you're taking your medication properly or not. Every time you pull out a pouch, the machine will record it that you took a medication.
Oh, okay. So these machines that you is this something that's billable under Medicare services, or or what's your understanding of that?
It's pretty new. It is definitely billable for certain medical conditions. We are actually looking into it, but it is billable under Medicare.
So that's still something that the viewers could potentially ask. If they were having some compliance problems, they could at least talk to their pharmacy about that and some of those options.
Yeah, let me clarify. So the pouch packaging, for most part, is free. Most pharmacies do offer
So pouch packaging, that's going to be either like the little plastic containers or the blister packs.
No, these are one-time use only. So you just open it up, rip it out, and then throw it out. So those are usually free, or if there is a charge, it's anywhere between $10 to $28. what I was talking about, the tracking technology is billable under Medicare.
Okay.
It's a new thing, but in future, a physician should be able to go online and just look it up, see how compliant you are.
Right.
And I think that would help take care of the patient better. It's not, the whole point is not to keep an eye on you.
Right.
But just to make sure. The ultimate goal of a healthcare provider, including pharmacist or doctor, is to make sure your health is in better condition. And whatever information we could get would be better to help you.
It's interesting that you talk about that because, often we'll see at our office, we'll see cases with individuals who have compliance issues, more so because they're forgetting. Or there's a caregiver who's only able to visit a few times a week. So some of those things that you're talking about really could be tools for caregivers that maybe, you live an hour or two away from your mother or your father and you're still trying to help. So some of that stuff to really understand and have those conversations with their pharmacies it would be ideal for a lot of our individuals. The one thing I wanted to quick circle back on also is when we talk about taking your medicines, like I'm supposed to take this 3 times a day. What's the importance around that? Like if you get a prescription and it says take it 3 times a day, why is it important? Why aren't you supposed to just down all 3 pills in the morning? When you're taking everything.
So it all has. It all has to be doing with the drug's half-life. So when a medication is prescribed 3 times a day, the body excretes those drugs, or the body gets removed those drugs faster than normal drugs. So if you take all of them once, you will have too much of a drug in your body, and then after a while you won't have any of that drug, so you're not going to benefit. So the whole goal is, if you look at a chart, you want to keep the swing as balanced as possible.
Okay.
So when a medication is 3 times a day, if I had to guess, the body gets rid of it between 8 to 12 hours. So or 8 to 18 hours. So when you take it 3 times a day, the peaks and troughs are similar.
Gotcha.
Or has close
kind
to
of even.
out,
You want to kind of keep it even.
And that's why they're coming up with extended release tablets, or so those are
so then you're not necessarily having to take it 3 times a day.
But
so that could be another conversation with your pharmacist if you're taking something 3 times a day, but you say, well, my doctor prescribed this, but it's really more simple for me to take it once a day. Could they talk to the pharmacist, who would then maybe have communication with the physician to say, like, hey, have you considered 1 time a day using an extended, I don't know what a medication example would be, but.
It would be like, metoprolol would be a classic one, where, a lot of the time you're taking it twice a day, metoprolol tartrate, and then if you switch it to metoprolol succinate, that's an extended release. You only need to take it once a day.
Right.
So it definitely, and that would actually, that's one of the things that we actually educate at the pharmacy also. We try to cut down number of pill and number of time. So there are times that we do reach out to doctors and say, hey, can we change this to the extended, a lot of the time, the extended release capsules or tablets are on the expensive side, not significantly, but if it's the same copay and everything is same,
right.
We reach out to the doctor and just be like, hey, can we change it to that?
Okay,
Great point.
Nice. So we talked about the packaging. Any thoughts on medication planners, or any tips that you would give individuals for different types of Medipant planners if they're filling their own? Is there any sort of common issues or errors that you're seeing, or types that you would recommend over the other?
No, I mean, in all honesty, whatever is comfortable. Like,
Okay.
you'll get different packages. If I do recommend having either separate box for time. So if you're taking it morning and night,
right.
you definitely want the box to be different.
Right.
Or it could have the same box where it's
but
just
it
morning.
has 2 lines.
Two lines. So you definitely want to take that. The other thing is, we do compliance, medication pouch packaging at the pharmacy.
Okay.
And it is so hard for us to make sure all the medications are properly aligned. So whenever you do that, just make sure the number of pills are in. the way we do quality check is number of pills in each box. So just make sure that each box has 5 medication for morning. So that's one other thing that you would do. But no, and weekly would be better. You should definitely do weekly, because if you make a mistake, it's easier to catch.
Right.
Yeah,
Then if
versus
you're
like-
doing a whole month.
Yeah, because I've seen people do 30 days, and it's
Yeah, and then that could really affect in the long term, as opposed to you're catching it in the end of the week. Understood.
And then but has a kids that are taking care of parents that they're not locally. We used to run a program called Take Back Your Sunday, where kids are taking care of their parents' medications on Sunday. But if you go on one of those programs at pharmacy that offers compliance packaging, either blister or pouch packaging, if it's no cost, then I think that would be the best outcome.
Great.
That way you could go home and make sure mom and dad are taking their meds properly.
Right, and then you'll actually see what's happening with the
date,
packaging and the dates. Great. So we have a couple more minutes left, and I really wanted to touch base on an important factor that I mentioned earlier, which was about vaccinations. This is the time of year, so I know right now I'm seeing a lot on TV about getting your flu shot, about getting your COVID vaccine. So you want to talk a little bit about that and what the pharmacies do offer?
Sure. So one of the biggest thing that I didn't mention what pharmacies do is vaccinations. Pharmacies were not always allowed to do vaccinations. We started doing vaccination, every state was different, but anywhere from 2010 to 2012. Pharmacists have increased the compliance, the vaccination rate significantly, because it's easily accessible. During this time, as you mentioned, flu, COVID, RSV is another vaccine that came out recently. It's a once-in-a-lifetime vaccine, so once you get it, you're good. You want to make sure your pneumonia vaccine is updated also. The other vaccine is shingles vaccine for 50 plus. Tetanus is another one that people forget, because it's every 10 years. So those are the common vaccines that offer. Hepatitis B, if you are, if you work in an environment where you'll be exposed to blood, or if you're diabetic and you're injecting yourself. But in general, pharmacists offer all vaccines, to be honest. But those are the 6 common ones.
The most common that you see. So. I don't know if this is a fair question for you, but are there co-pays? Like, how does that work with and maybe that depends upon your prescription plan or whatever for the vaccination. So can you talk a little bit about the costs around those
If your
things?
insurance, 99% of the insurance do cover vaccine for free.
Okay.
It was mandated in one of the law by Obamacare that insurance do have to cover preventative care.
Gotcha.
And vaccination is preventive. So I would say 99% of the vaccines are covered by your health insurance plan.
And then for most pharmacies, I think a lot of them at this point, you can even do like a walk-in. You don't necessarily, because it's a pretty quick process. Just kind of walking in and saying, hey, I'd like to get my flu shot. I didn't get it at all this year. And then do you give them a card? Is there communication that goes back to their doctor's office that they receive their flu shot? Like, how does that happen? Does that just go into your system?
So with the Medicine Shoppe, the vaccination is so quick. We do it in 5 minutes, less than 5 minutes. You walk in. If you have your paperwork filled out, you're in and out in 3 minutes. Regarding to what we do is we give you physical cards with vaccine record. We also upload it on the state website where any provider could go in and check.
Okay.
So our system is connected with the state system. Most pharmacies are, actually, to be honest. They're connected with state system. But for us, we also go extra because we do a lot of vaccinations. We'll also do physical cards, so when they go to their doctors,
they can hand
can hand it easy. It's easier for them and the provider office as well, instead of looking up the state website.
Okay, great. I did want to put a plug here for I am aware that one of our local senior centers is holding a vaccination clinic on December 9th. It's at the Mifflin Center in Shillington. It's from 11:30 to 2:30. It's the Mifflin Center, which is one of our contractors with Berks Encore. Their number is 610-777 5577, and you can call for some more information. But I know that clinic is going to be, that's being sponsored by the PACE program, the statewide PACE program, and you can call and get some more information. And I think we're going to have some other availability come the new year down here at the local Hispanic Center. I know they're working with PACE also to do the vaccinations, have a clinic available. So thank you so much, Dr. Patel. This was really a great segment. I think time flew for us. We hit a lot of different areas. You know, I would strongly suggest, because I have always found that, especially in working with the older adult population that we do, reaching out to the pharmacies and trying, especially if you're having issues with compliance with medications or not understanding, they can at least help you and kind of point you in a direction in addition to talking to your physician. And they can also help you with some, like you talked about, some of the compliance things and ensuring that you're taking your medications as prescribed. So thank you so much again, Dr. Patel. It was great to meet you. And that's the end of this episode of Aging Matters. See you next month.